Hello, hello, sir. Can you see us? Can you hear me? All good?
Yeah, yeah, Aditi, hi. How are you?
Good. How are you, sir? How is it
Super,
going?
super, super.
Awesome. So, just for everyone who's watching us, so just to give a quick intro of the time as well, I am here in Adelaide, Australia. My name is Aditi Shirali. I'm a psychologist, was working in Mumbai, now working in Adelaide, Australia, registered with the medical board here called APRA. Some of you already know we've started a little initiative called as the T Connection. So, T Connection is basically a little collective effort of spreading mental health awareness, but doing it collectively, not just doing it as one professional, but getting all professional under one umbrella and getting and showing it to you the best therapists, the best psychologists that we have across the globe and getting their expertise to you. So today I'm really privileged, to be honest, very excited like a little 5-year old, because my mentor, my guru, everything you call it, Dr. Rajiv Naidu, is doing the first Zoom podcast with me today. Um, who Dr. Naidu is, I will definitely introduce, but what he is to me is a lot more, and you will know as we chat. I think today who I am, what I am, and what I've been able to achieve is, I would say, 70% thanks to him. So thank you, sir, for agreeing to do this. I
You're
think just
welcome.
before we started the recording, we both were discussing that how technologically naive and challenged we both are. So forget the content, just doing this overseas, I think is a big thing for both of us.
Both of us, yeah.
Just to give a quick intro about Dr. Rajiv Naidu, he's an author, homeopath physician, a life empowerment coach, mind body wellness expert, an integrative therapist, somatic therapist, which is what I think we are here today to understand, the mind body work that I feel is path breaking. A past life therapist, hypnotherapist. I've trained for hypnotherapy under him. Advanced neuro-linguistic programmer, a Gestalt therapist, counselor, health psychologist, life coach, and a transactional analysis trainer, healer. And of course, he's done a lot of work in the success money mindset coach, and he's trained, I think, number of corporates, number of people across the globe. He's the author of Giving Up Something to Receive Everything. It's a powerful book with simple to understand, and I think that is what I can totally vouch for. We have a lot of psychologists, therapists, healers, counselors across the globe. One thing that I feel sets Dr. Naidu apart is his simplicity. He can tell you the most complicated things in such a way that you're confused. Am I so naive to understand, or is he such an expert that he explains things so easily? So I think Dr. Naidu saying that, my first question to you, sir, would be, how do you do it? Like in terms of, I've always seen this right from when, I think I was 18, 19 when I did your first level 1 hypnotherapy, to then of course you coming to a lot of my mental health awareness programs and everything. I think every time your simplicity to explaining concepts is brilliant. How do you do this?
Okay, so that's a good question. And I keep wondering that how do you do it? Because there are a lot of people who give me this feedback. And one thing that I feel has worked for me is that my own sickness,
Mhm.
my own problems in life, my relationship issues, my health issues, my inability to deal with people around me. So that has really worked for me. Work for me in the sense like when I was going through it, I would always wonder, like many people, that why is it happening to me? Like feeling so helpless in those situations, and why is it that all the other people are having a great time and enjoying life and being so confident, being so powerful, and I am not. I feel so incapable. I cannot speak to even one person properly. Forget public speaking. I cannot do that. I tremble in my shoes and my hands tremble. I sweat. I get anxious. I cannot visit places. I cannot sit in a restaurant without thinking that all the people are watching me. I cannot visit public toilets. I cannot. I have to search for loos wherever I go because I don't know when I would get that urge. So these are the struggles that I was going through, and of course, relationship was a big issue, and my anger and my aggression was a big issue. But what really worked for me, which I where it I think it makes it simpler for me and for others also, is that I started breaking it down. Every time I went through it, I started breaking it down into small, small pieces
Mm.
and trying to understand what is happening, where is it coming from, what is happening to me, how am I reacting to it, what is it that I really want in my life, how do I want to behave, how do I relate to people. And I realized that in my mind I was processing everything.
Yeah.
And I started breaking it down into the simplest piece possible,
Mm.
thus that I could understand and then make a shift in my behavior and check the feedback out there. And when I checked the feedback out there, I noticed a huge change happening in the relationship and in my own self as per as vis-a-vis the disease. And that is what started giving me an idea that when if I have to do something for anyone, I didn't know this earlier when I was making it simple, I didn't know it. But for a period of time, when I broke it down, that how am I processing? This is the answer. And that's exactly what I share with people. When they ask me, I tend to process it in a way such that it can be broken down to the simplest and what is the first step for them.
Absolutely.
And that is where it becomes much more easier. But I think it is self introspection that has brought me to this point. And my funda is very simple. When we all used to come for the hypnotherapy workshop, the first sentence I would say, let's make hypnosis simple.
Yeah.
Let's make hypnosis simple. And I would keep wondering, why do I say this? Because people see hypnosis and hypnotherapy as, oh God, it's something huge, big, I can be controlled. And that is the time when I realized that let's make hypnosis simple. And then the students started understanding it as if it was like a child's game. It was not something that is only a few select who are blessed with that kind of power, they only can do it. They realized within 3 hours that anyone can do it. And that is how I started living my life.
That's fantastic. And it's amazing how you see it like that, because I think you will agree to this when I see a lot of clients as well. And also the first human reaction to things is always to see the result, Why is this happening to me? Like, what is happening? But I think very few people have the ability to actually step back and then break it down. And I think that's what is something that you're able to do, and that's what we have to, I think, teach people to do it, like break it down. That's the
And
power.
also, when you're saying this, what the word that comes to me, that is what I keep doing is objectivity. Like step back. It's a process which I teach people is called step back 5. So that's a very pure objective way of looking at it. Objective way of looking at life, objective way of looking at your life, problems. When you become objective, then the problem becomes very, very small. Like I'll just narrate one example. I was having a client from the US at a very high post, 55 plus, and having a lot of problems in his family, especially with his wife. So much so that he couldn't tell anyone that my wife is going through this problem. Every time, whenever I speak to her, there will be a 2 hours severe, serious argument. And he would say, she just goes on and on with the problem. She just doesn't stop. And she keep blaming my family members, saying that they're wrong. So much so that he started calling her delusionary. But she just doesn't get out. There's nothing like that. But it's a delusion that my people are bad. And I said, so better meet some doctor. He's saying in US, it doesn't work like India. You can't just go and meet a doctor and say this is, the client has to say yes, which is so clear. Like even in India, the psychiatrist won't say, okay, you come and we give medicines. It doesn't work like that. But there, it doesn't work simply that I know the doctor is my friend and everything happens. It doesn't work. That India, it might work.
Yeah, it's
Some
true. Same here. Yeah.
So there's a protocol to it. And when I told him that, how would it be if you could just step back from the whole situation and look at the situation? Right? And how would it be? This is something that really worked for him. How would it be if you, instead of seeing the problem as if it's overwhelming and taking over your life, it is just a part of your life. It is just an issue with your wife, but you have your travel, you have your work, you have your colleagues, you have your hobbies, you have your fun time, you have your children. And suddenly he says, Rajiv, it makes so much of sense. It's actually a small part of my life. It's not my entire life. And I can be happy otherwise also. And it just was another 2-3 sessions. you'd come back every time. He calls it compartmentalization.
Okay.
Even
Mentalization.
today, he's written, Rajiv, compartmentalization works.
Mentalization.
He's just compartmentalized that, and he
Mm.
says, rest of my life is working. And now he says that instead of the 2 hours, she
Mm.
ends within 15 minutes.
She has
The argument. She ends the argument in
ends the
15 minutes.
argument. Wow, that's
Is
really
because
good.
I can see it objectively. So
Yeah.
I don't react. Otherwise,
Yeah.
I would try to tell her, no, this is wrong, this is right. And I would keep arguing, and that would take it for 2 hours because she would be stubbornly holding on to her views.
Correct.
But now I don't fight, I just let it go. I just leave it, saying that, okay, that's a point of view. Let her express her point of view. And suddenly the whole thing fizzles out within 15 minutes, and we are back to normal.
That's fantastic. It's a very good point you mentioned because that could lead to the next question from here because that's something which I get a lot from my clients is how to compartmentalize because I think what happens is it's like I said, I remember again going back to when I was a teenager and how you had helped me and my father like my dad is this he is a great in compartmentalizing. So I think I've got that quality from him and then your teachings has helped me. So I see that in my life where I can there are lots of issues going on but they're happening on the parallel track. Of course,
Hmm.
it impacts maybe instead of getting things done in 3 days, I'll take 5 days because of the impact, but it'll happen. I don't stop
Yes.
my life because something else is affecting me. But
Yeah.
I see a lot of people in my family, in my friends, in my clients, when I try to explain that to them, their first question is, how do we do it? We can't do it. It impacts us. There's a lot of if and then, jo ho ye hoga, fir dekha jayega. If this gets sorted, then I will work on my career. If my relationship with my mother gets sorted, then I will work on my career. If the relationship with my husband or partner gets sorted, then I will work on my career. But unfortunately, that if and then I know that will never going to happen, they also know, but then that leads to the whole the whole victimization part of it. So
Yes.
if we I could ask you from on behalf of all my friends, family and clients as well, how to compartmentalize and how we can help people actually have that objective mindset, how to make that switch.
Okay. So first of all, let me go back to that point where you said that generally people see it as if this happens, then that.
Yeah.
Okay. Life, one thing we got to get is life is not linear.
Mm. Yeah.
It is not like a bogie of the train that from one bogie to another. No. It
Mm.
is happening in this fashion, in a very non-linear fashion.
Mm.
And that's why when this impacts your relationship with your close one impacts,
Mm.
it takes away your whole life, your entire life. You're not interested in your friends, you're not interested in going out, you're not interested in dressing, or you are not interested in dealing with your kids for that moment
Yeah.
because
Yeah.
it impacts like this. And the
Correct.
moment it is cleared up, suddenly you seem to be interested in everything.
Mm. Mm.
It is not that, oh, I'm interested in that person
Mm.
and my relationship with my father is okay, so now. No, it
Mm.
just impacts everything. So it's not a linear thing. It doesn't
Correct.
work like, yeah.
Correct.
And also one more thing I say, it's not 1 plus 1
Yeah.
is equal to 2.
Yeah.
1 plus 1 can be 5, can be 3, can be 0, can be -2,
Correct.
and it may never be 2.
Correct.
So once we start understanding life like that, that it can give any result and it can
Mm.
actually slap on your face anything, though you expect something else. That's the time when we
Correct.
are okay with whatever comes to us. That's the
Mm.
time when you are able to objectify something, able to be objective about it, and even compartmentalize. That's the beginning of it.
Mm.
Secondly, what helps you compartmentalize or is having that ability or training yourself in
Mm.
mindfulness,
Okay.
the ability to see what's happening within you,
Mm-hmm.
the way it is happening, not why it is happening.
Okay.
Okay, it is like what is happening, how it is presenting itself in me. For
Correct.
example, uh, I do like something called core somatic integration, which is a signature workshop, and that is exactly what I use in most of my work. That's what I practice for last so many years. So it's basically about When people come with anxiety, they say, oh, I don't know why I'm getting this anxiety. I should not be getting this anxiety because there's nothing wrong in my life.
Correct.
Yes, there's nothing wrong in your life, but your body is speaking a particular language, which is the language that you have not been trained in your school. You have been given 1+1, you have been given history and geography, but not the language of the body. And you are reacting and relating to the world from the language of the body, which is very unconscious to us. Once we are able to observe that, then you are able to even, means you can choose to respond rather than to react. And when you are able to do that, then you can go ahead, whether you want to compartmentalize, whether you want to put it aside for some time and then take it up, or you can choose the way you communicate to yourself or to the people or the environment. Right?
Correct.
That is where it comes in, like where we are able to look at things in a very logical and a rational manner. But for that, you got to be very mindful about what's happening, what is happening within you. And how does this work? Basically, we are looking at the body is expressing itself. It has its language. Yeah.
Correct.
And it is always there. But you ask someone what is happening inside you or what is happening to you. Like I have a lot of people who come with a lot of anxiety. I specialize in anxiety and trauma and PTSDs. So therefore, when they come with severe anxiety and I tell them what is happening, what are you feeling? Nothing. I don't feel anything. I can't feel it. Yeah, that's one of the ways when you dissociate. That's a different story. But they are having that heartbeat, dug, 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 or they're feeling the tightness in the body, but they don't relate to that as a symptom of anxiety. Because for them, anxiety is just a concept, a word. As a diagnosis which some doctor has given them, some psychiatrist has given, they cannot relate to others. And even if they are doing it, oh, I got anxiety, it's a vague phenomenon for them.
Absolutely.
They don't realize that it's all the symptoms that is the expression of anxiety. And if you want to actually heal it, you have to get present to that experience that is there in the body. And once you're able to do that, then you are able to actually say, okay, now what do I want to do about it?
That's a very good thing. And I think that's what mind body work is, something that I really want to touch upon. So I have a few queries in terms of like because I feel like I'm trained in this profession, I'm trained with you, under you, worked and have practiced it as well. I feel like I can understand this concept. But if you remember, if you have done sessions with my friends and family and they have come back and sometimes taken a lot of time to understand, I don't know what I'm feeling. Like, how do I tell sir? Like, kya batao? I don't know. I don't know. I don't know. So that I don't know. First of all, like in my therapy, I hear so much of I don't know. I understand a lot of people, it's not that they don't know, they have not been trained. I think that's a fantastic point that you brought up. That in school, we are not actually trained to listen to your body. And I would like to just tell this, that with my 7-year-old, like he's going to be 7 this month, but I have been naturally trying to help him listen to his body, and I can see the change in him as a child. Because when the focus used to be on the behavior, why you're doing this or why you're yelling, I've started asking him that when you are not listening, can you tell me what is happening to 5 things? What is happening to your breathing? What is happening to your heart? What is happening to your brain? And then he's able to break it down. And now I can see out of 10 times, 5 times, he'll come and tell me, Mummy, my brain's not stopping. My heart is really racing. Can I take a time out? And I feel like for a 7-year-old to have that ability to say it, it's brilliant. But when I look back, I wish somebody had taught us when we were little and not
Yes.
just focused on the behavior. So I think my question would be, to sum it up, how to connect, like how to get that mindfulness in the body, because unfortunately the world that we live in, we are so superficial right now. Everything is so, like, 3 seconds, 4 seconds. Nobody has the patience to actually just focus on yourself. So to start that mind body work, to understand your own body, where and how can a person begin?
Great. So first of all, let me also clarify something over here, Aditi. The child is aware of what's happening.
But we don't ask them, or
We think Yeah, we think that the child is not aware. The child is always responding from feelings.
Feelings, exactly.
Child looks at you and you make a face like this, the child also goes,
Yeah.
even a newborn. Are you
Yeah,
getting
yeah,
me?
yeah, yeah,
They
absolutely.
just respond. And the mother is unhappy, the mother comes close, the child also feels it.
Yeah.
Or there's a happy atmosphere, or someone comes in and very vibrant, the child feels that wants to get close to that person.
Mm.
All right. And someone is not, they don't want to. So this is how it is. So basically, the child is always very, I would not say the use the word mindful, but the child is very much aware of, because they're only
Yeah.
responding to feelings.
Physical feelings.
So instead of learning, we got to go back to that point.
So we know
Yeah.
it. You mean like we have it in us, but we have forgotten it over the years.
Yes, because we have not been trained
Trained,
to
correct.
look at it. Like you're
Correct.
training them.
Correct.
Yeah. And
Correct.
they will also do that.
Correct.
And
Correct.
many of the parents I've seen, they started because now they're very much aware. They're
Mm.
training them that how do you look at, yeah, their
Yeah.
responsibility teaching. Because, and we also train them thanks to our parents.
Yes.
Why? Because we went through a bad time with them and
Mm.
we are struggling. So we are trying to be, okay, this is what my parents did.
Yeah.
It's not work for me, it's not work for them. Let
Yeah.
me change my way.
Yeah.
And most of the people, I would say that when they suffer too much, they become counselors and therapists. That's what I generally say.
100%.
I tell my clients also, okay, if you're going to a good counselor, good therapist, get that his or her life was really horrible. And they're doing a good job because they have worked on themselves.
Yeah, unlearning,
Yeah.
unlearning, like you can connect.
Yeah. And so,
Yeah.
and as you rightly said,
Mm.
the body is always communicating,
Mm.
but we have not got trained to listen.
Mm.
Are you getting me?
Yeah.
And we have got trained to listen to the body
Mm.
in a way such that we create disease. But we
Okay.
have not got trained in a way such that it can heal.
Wow. Yeah.
Yeah. And
Yeah.
we are not communicating to the body like that.
Mm.
We are communicating how to break down relationships.
Mm.
We are communicating how to create a disease. We are
Mm.
communicating how to lose money
Mm.
or live in poverty.
Mm.
But we are not communicating to ourselves to create wealth or to
Mm.
have beautiful, lovely relationships, or we are not communicating to have health. So basically, the body knows how to do it
Mm.
because it's all intelligent,
Mm. Mm.
right?
Correct.
But
Correct.
we have not been trained. So here, the idea is to train. And how do you train? Again, we start with introspection,
Okay.
with mindfulness. The whole mindful thing is that because the mind and the body, they are the two sides of the same coin,
Absolutely.
right? You cannot have one side to anything. You have two sides, right? So people say, oh, this is, you're just thinking. There's actually nothing there. There is something there, even if you're thinking, right?
Yeah.
Because over a period of time, it's going to develop and express itself as a disease.
The disease.
So this mind-body connection is very important. How do you do that? You just like, again, we keep going back to the whole problem from a mindfulness angle.
Mm.
How do you view it?
Mm.
And look at the way you're communicating. How do you communicate? In the form of your thoughts, in the form of your feelings, in the
Mm.
form of your emotions, and in the form of your behaviors.
Mm.
Right? We are communicating. Once you start understanding that, you know that how do you, in order to deal with it, I got to do something different. So basically, you got to understand what is happening. So a lot of these people come in with anxiety and they say, I have anxiety. And I said, what's happening? Say, I don't know. The thing is that my heart is going good, 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 good. That itself is the anxiety. So we are just giving the word, the concept, but we are not explaining that all these are symptoms of anxiety. And instead of looking at anxiety as just a word, when you start relating to any problem, even without the name,
Mm. Mm.
as experience,
Absolutely.
then you will start noticing a big change happening, because then whatever you want to do, you can do with it, be it compartmentalize, rationalize it, tame it down, or even resolve it.
Mm. Mm.
give it by giving it a new response. All those things you can do.
Absolutely. Is there anything like one more thing, anxiety? So anxiety is again, I think, very common presentation that you get in a private
Yes.
practice, right? Like
Yes.
you said, either be it, I think there's also a book now called The Anxious Generation, because the times that we are living in, especially the teenagers, young adults, because of the AI growing technology, I think the patients just normally being mindful and having that instant gratification is
Yes.
growing. So
Yeah.
definitely anxiety is increasing amongst the population. So one common presentation I get is when I am, for example, I teach them the tapping, I teach them the breathing, everything. They will practice it, but they say that, for example, when I'm feeling panicky or getting a panic attack or having the whole anxiety, physiological reactions to it, how do I feel like that a lot of people come and tell me they have that out of body experience, as if I'm there in the mall. Like, it's, for example, one expression, one presentation that I have is I'm in a mall and suddenly people are around me and I feel like I'm there but I'm not there, so I'm so caught up with my physical and emotional feelings. How do I snap out of it? So what could your take on that be?
So let's first understand this. This is also a symptom either coming from fear and
Hmm.
and anxiety. So basically, I'll ask you a simple question. Suppose you are in a situation which you are not comfortable with,
Hmm.
or you're not enjoying.
Hmm.
What would you like to do?
Get out of the situation.
Get out of the situation. You don't want to be in that party. Are you
Correct.
getting it? But you
Correct.
are with your friends, you want to stay there.
Correct.
But you are in company of all unknown people, no one knows you,
Hmm.
and you want to get out of that place as fast as possible, right?
Correct.
You don't want to stay there. So that is exactly what happens. And this just
Yeah.
and this phenomena this phenomena is called dissociation.
Okay.
You dissociate from the situation,
Mm,
and that is nothing else but a way the body has learned to survive.
mm,
Like, you know this, that when there is severe trauma,
mm.
many people have just dissociated, and that's how they survived. That there are so
Yeah.
many instances where a person has met with an accident,
Yeah. Yeah.
right? And bleeding, got a
Mm,
fracture, but the person has walked to the hospital and without feeling that pain, and the moment they reach the hospital, they collapse
mm,
because they just dissociated from, and we call them, oh, they were so strong. No, it's a natural survival mechanism,
mm.
because with that pain and that shock, you will not be able to survive, you'll die.
Correct.
So
Correct.
this is a very natural phenomena where you separate so that you
Mm,
can survive that occasion. Now, same thing, when it's overwhelming, the mind goes away. Like, for example, I still remember, you will also relate to this. You are in school,
mm.
right? And you have a teacher who's very exciting. You enjoy you have full ears.
Yeah. Yeah.
But you have a teacher who comes like that that Independence Day uh, uh, what is speech.
Speech. Yeah.
After 5 minutes, 15 minutes, 30 minutes, and you're like, God, when does this stop? I get looking here and there. Or I still remember when the teacher was going on, it was so boring that I was looking at the horses that were there in the lawn out there, yeah, in that ground out there. I was just dissociating from that
Mm.
lecture because it's so boring. Or
Correct.
you're just dreaming. So it's
Yeah.
also a way of associating. So
Correct.
here also, it's so overwhelming for me
Mm,
that I cannot handle it. So that's
mm,
the body, the mind or the brain just dissociates from the situation so that I can survive the situation. And
mm,
nowadays it's too much because I cannot say that, oh, I dislike it, I don't like you.
mm,
I
mm.
am there, but I'm not there, kind of thing. So that's a way of actually separating yourself. Now, how do you deal with this? Because many people keep dissociating. That becomes a habit.
Yeah.
That becomes a pattern. Like they're sitting there, and then you can be termed as many other ailments. Like you keep dissociating, you're not there, you're having attention disorder, whatever, right?
Mm, mm,
Now, one of the things that I train people is to get into the body.
mm,
Because the body, once you start connecting to the body, then you are in the here and now.
mm,
The reason is that we are getting out of the body. And whenever there's a trauma, You get out of the body so that you can survive, right? And when you feel safe, you are in the body. It's like being with friends and not being with friends. You got to feel safe. Same way. How do you do that? You first of all, one of the things is about the breathing. But when you're anxious, many people say, "Oh, but I tried the breathing, it didn't work." It will not work at that moment if you're not practiced it.
Correct. Correct.
Right? If you're not practiced it before and you don't become habituated, you know the nuances of it, you will not be able to use it. It will not have an impact on you. So one of the things that I recommend is touching your body.
Okay.
Because the body is feeling unsafe.
Correct.
Like
Correct.
own child. When the
Yeah.
child is scared, what do?
Yeah, you want to just, give them that
Just
bodily
hug.
warmth and that, yeah, that I'm there for you
You
kind of.
come close and you hold the child.
Yeah.
What happens? The child, why the child is like feeling good? Because
Mm.
the child is safe. That
Yeah.
I am with someone whom I can trust. And I know this person will take care of me. The child will not go to anyone. The child will come to you or your husband. Are you getting me? Or the brother, if it's a younger
Yes.
sister.
Yes.
I'm safe over here.
Yes. Absolutely.
Right?
Absolutely.
Same with for the body to feel safe, you have to allow that you have to uh, touch the body. That's one of the ways. Just touch the body.
Yeah, I love that concept. That's so
Even
true.
if you do that, yeah.
We don't
Because
realize na, how impactful it can be. It's true.
yes, and try it after you are going through, like after you completed your clinic sessions and all, and sometimes you are overwhelmed.
Yeah, yeah.
Just leaving or once you reach home, just touch your body
Yeah, that's
or
true.
have a good bath.
I think that's why a lot of people love the hot showers after coming from work because it gives
Oh,
you that release of that stress.
yeah.
Yeah.
And for a client, what you should do, you can try it now. You just press the thigh.
Okay.
Okay, just press the thigh. And one of the things that can be done is press the knee together.
Okay.
Press the knee together and push the knees outside.
Okay. So
With
it's
your hands, press it, but the
okay.
knees are pushing outside. That gives a very powerful grounding mechanism.
Wow. Yeah.
Secondly, push your feet on the ground
Yeah.
or stamp.
Yeah. I've told that too.
They're
Yeah.
all grounding mechanisms.
Yes. Grounding is very
You know,
important.
that really grounds you. Even holding the hands.
Hmm.
But all this is very safe. This is very beautiful.
Yeah. Correct.
It's a very beautiful, like it just makes
Yeah.
you
You're like hugging yourself. Yeah. Yeah.
hugging you.
Yeah.
It's
Yeah.
basically simply making you
Hmm.
feel making yourself feel safe.
Yeah.
Either you feel unsafe or you feel safe. When you're unsafe, you dissociate. When you're safe, you associate. So that's very helpful. But that's something that you can keep teaching all your clients. It helps.
See, again, you said the most amazing thing in just like that. This is such a powerful statement. Oh my God, this is going to stay with me. I think whoever is listening has to just put it in your system. When you're feeling unsafe, you disassociate. When you're feeling safe, you associate. Wow.
Yes, simple.
That is such a powerful statement because I see a lot of children as well. A lot of children with the autism spectrum disorder, and most of my autistic kids, they do, or the kids on the spectrum, they do talk about feeling safe and unsafe. Like
Okay.
that is their crux of their emotions. Like, what, however they react. When I try to break it down with them, they always come to me with, but Aditi, when we do this, this makes me feel safe. When I do
Wow.
this doesn't make me feel unsafe. So safe, unsafe for them is such a important part of their lives. Like going to school, I don't want to go to school because I just don't feel safe.
Yeah.
Things like that. And sometimes it's very difficult for the teachers and the parents to understand that, because a lot of times I think the safe unsafe word is not understood by a lot of people. A lot of people
Yes.
feel safe unsafe means abuse, or safe unsafe means only some kind of physical or violent threat to you. But
Yes.
it is beyond that. It doesn't have to be any physiological or emotional, violent abuse. It can just be feeling. For example, I can say that I feel a lot of times I feel unsafe in new social situations. because in
Yeah.
my head I still have, that thought that will people like me, will people approve of me, all of that. Even this, the whole doing the online mental health awareness has taken me years to come here, knowing deep down logically that it's going to be fine. I know it, but like you said, your knowledge and wisdom. So it just taken so much efforts, because to be honest, social coming out like this on social media was very unsafe for me. So I could
Yes.
see that I was actually disassociating, I would
Yes.
always find reasons not to do it.
Yes.
So, so today morning I got up with that.
And this is not a physical unsafe feeling.
No, no, no. It's just, yeah, I think it's everything. It's just,
It's not a physical thing. It's not coming from, there's no
yes,
physical,
threat,
it's
correct.
emotional, it's a psychological threat kind of thing.
Absolutely, absolutely. And that's very, very
And
important to
we got to
understand.
acknowledge it for everyone. And that's why
Ab-
it's different for different people. In the same situation,
Mm,
this person might react differently.
mm,
And people ask, but why did you have to react there? Because that person didn't feel it right.
mm,
Once we start acknowledging this, I think a lot of your relationship issues will get resolved. That the person can behave differently than me because the person feels it differently, experiences it differently. Only simple reason, because their experience right from childhood has been different.
absolutely.
But you could, I was quiet in that environment. Why didn't you do that? You could have also been quiet. No, but I've been trained to beat up or
Yeah.
scream or yell, because that is the what people have done in my family. When there was a problem, there was aggression.
Aggression,
In your
exactly.
case, when there was a problem, it was like subdue yourself, become quiet. But that's not my environment. And these two people get married.
That is true. Acknowledging. I think the other day there was a funny thing happened which I can share, which is so I have once in a while I have a cook who comes and helps me cook stuff and everything. And that day she was there when my kids were there, and my kids were yelling and screaming and running while her daughter was quietly sitting there. And then this one sentence she said, which is I think very common in Indian context. We use it ki नहीं वो हमने हमारे बच्चों को चिल्लाना नहीं सिखाया. So,
Uh,
I've not taught my kids to shout or yell. And I told her, I also don't tell them every morning, sit, shout. Ah, this is how you shout. I said, I have also not taught them. But yes, as a family, we are pretty loud. And I think that's how my children are. But they are yelling and screaming for fun. So it's fine. The moment it becomes, something from a trauma response, then I have to stop it. But yes, loud as a family, we are. So I can't stop it. This is how they all are. So yeah,
and
but that's the
and
response.
also one thing that we have to realize, like many people, as we are growing up, means we call ourselves civilized and progressive and all that. But the thing is that though we say tolerance,
Mm,
or we want to take it in our stride, but internally we are not being tolerant.
yeah,
Yeah.
yeah,
And
absolutely.
but the thing is that you can only develop tolerance by going through things that they are so intolerable.
Mm,
You
yeah,
can only learn freedom, or you can only learn discipline when you have enough freedom. When there is no freedom,
yeah.
you don't even know what's freedom. What's the point of having a discipline?
Mm,
You don't understand discipline because you got to understand both sides of the coin,
absolutely. Absolutely.
right?
Yeah. And
So it's like if you want to learn about money,
mm,
then you have to earn so much. Then you
mm,
get disciplined about money. You never been given money and you say I'm disciplined. No, you never had money. What's the discipline? Are you? You have the money. The child says, I have the money, I have the resources, but now I will not buy the ice cream.
mm,
Now I'll not buy it because now I am not well. I'm not going to buy it now.
yes.
When I'm okay, I will. So they know that I have the resource. I can easily go ahead and do it, but I'm learning when to
When
do,
and how to
when
use it.
not to do it.
Absolutely.
Very,
That brings me
very
to
simple.
one. Yeah, you were saying something?
Yeah, it makes it very simple then.
Yeah, because I just had one more concept. I think is a little off track, but it's similar to what you were saying. I think a lot of people, because again, coming back to the societal situation right now, I see that people um this human tendency to never be satisfied, right? To always want more, always to compare yourself to other people. Especially with social media, I think it's becoming very common for people to constantly have that comparison. So how can a person, help themselves not to get caught up into that comparative streak that is definitely pulling down our mental health?
See, I think the whole uh, conversation that we are having going keeps pointing towards one thing for me, that is again and again becoming mindful.
Yeah.
You can only lose yourself when you're not mindful.
Yeah.
Yeah, there's nothing wrong in that,
Mm.
right? I tell a lot of my clients it's okay to be on social media,
Mm.
but know whether you're using the social media or the social media is using you. Because there's someone making profit out of you.
Yeah, 100%.
You better make a profit out of that.
Mm.
Because there's someone making profit when you watch. But if you're watching, see to it either you're learning from there, but don't make it a habit that I'm learning. Don't use it as an excuse.
Mm. Mm.
But use it like you're using the social media because I want to people have I want to use it as marketing tool. I want people to know that I'm existing as an X person and my business is growing. Great. So it's a great tool. Like earlier we used to do it in newspapers, now we are doing it on social media. But see to it that it's not using you. How do you do that? When you become mindful, when you are very clear about the goals that you are having in your life. Why am I using this?
Mm.
Yeah, and even if I'm doing it for fun, I want to spend my time that I don't want to do anything. I just want to watch a movie or I just want to watch the Instagram. I'm going to do it. But
Mm.
that's a very deliberate attempt.
Mm.
Are you getting me? It's a deliberate thing because you're aware of it.
Mm.
When you're not aware of it, then it starts using you. Then it becomes an addiction.
Yeah.
Then it becomes an addiction because you're just going and you don't even know when to stop. But if it's a deliberate thing, this is the time I begin, this is the time I end. It's a very deliberate thing. Like when I was doing Tai Chi, my teacher used to use this word, deliberate. And I would not get it. But he used to say, okay, you got to deliberately move. You have to make this, it's a deliberate move, very conscious.
Mm.
It's a very conscious move that you make.
Choice. Yeah.
It's not an unconscious move. And I learned so much from him when I was doing it because this word is so powerfully embedded in me that it's a deliberate move. So when we move, it's not that like when I'm doing this, I would not be aware.
Mm.
Yeah. And I'm doing it. But the thing is that I can do the same thing in a very aware fashion.
Mm.
Right? I can do it. I know when I'm using it, why I'm using it, like an actor.
Mm. Mm.
He knows when to put down his eyes, that is looking down because he wants to produce a particular impact on the audience. But when I'm doing it, I'm not aware that when I'm looking down, I'm actually feeling low or I'm feeling sad.
So would you say that when it comes to, like, just summing up what you, like, just connecting the dots of what you said, so would you say, be it anxiety, be it relationships, be it the whole self-doubt and
Mm.
self-esteem, all these major issues that I see and hear every day, and I think we also go through personally, what I'm understanding is that one is the mindfulness, second is the
Mm.
deliberate efforts to bring about a change in our lives,
Yes.
right? Otherwise it's not going to happen, because I think that's a very common thing that people say very loosely, but mujhse hota nahi hai, like I can't do it,
Yes.
but if you don't put in the efforts to actually make it happen, then it won't happen. Is
Yes.
that right? Yeah.
Yes. So it's like very well said that it's not that I can't do it. If you start saying, I don't want to do it, that gives
Mm.
me a little power, as if I'm in control.
Mm.
It's not that I can't do it.
Mm.
I don't want to do it. I choose not to do it.
Correct.
So they're saying, but it's happening on its own. That's exactly the problem. Are you getting it? That's
Mhm.
exactly the problem. It is happening on its own. Until the time you don't become mindfully aware, you will not be able to put a mindful effort into it. Until the time you don't put the mindful effort, it will not bring about the kind of change in the direction of the goal that you want to accomplish.
Yeah.
So
Again,
it's a
one
very mindful thing.
count act question. So if for example, if the viewers or whoever is watching this, or for just for me to understand as well, if we have to start, because I know a lot of people, like it's sometimes, because I think we are in this field, sometimes I feel, surprising something. Oh, people are not doing this. But even a lot of times I know when we catch up for our sessions, I don't practice what I preach a lot of times.
Yeah.
So as a layman, as a person who's not into the mind body work, like I feel like a lot of people still do not understand the concept of mindfulness, because we don't, like you said, we are not trained for it, we are not doing it on a daily basis. And now with technology, I think the mindfulness is going out of the park completely, because we are in an autopilot mode. So how
Yes,
do we
that's
break that
absolutely.
autopilot? What, few things from your end, like you said, one was of course the exercises to do, but is there anything on a daily basis? I've heard and I know from you personally, journaling is one big part of
Yes,
thing that helps you gather those thoughts. So can
big
you
time.
tell us
Yeah,
about that? Like, would that help in mindfulness? Like, would the journaling help in mindfulness?
I can just give you examples of so many clients. Like one of the clients came in and reinforced this belief in journaling that was just maybe a month back. And that
Mm,
person said, the person came for a few sessions, and I recommend journaling to almost everyone. And that person says, this, whatever you suggested about journaling, that's completely changed the way I look at life.
mm,
And the person was really struggling a month before that. And the person says, I am aware of what's happening in my life, what's happening, how it's happening, why it's happening, who's behaving, how am I thinking that is creating the situation? How
mm.
do I react? You think it's so empowering,
Yeah.
because I know how I am dealing with that and how I am struggling with it. I am aware of it. Now, if I'm struggling, I can change it because
Correct.
I'm aware of it. And
Mm,
that is what a journaling provides you with, that power, that it gets you empowered to look at situations, what's happening within you and around you in a very mindful manner. And
mm.
that is what causes the change.
And is there a way to journal? Like, what would you say if somebody who's not journaled all their life, how would they start it?
So one thing is just putting down everything that is there. Yeah.
Mm,
But when you're putting it down, if you're aware of what you're writing, it's very important. Yeah. I generally tell people there are two ways. One is write down the negatives and just pour it out. And
mm,
don't try to censor it when you're writing it.
mm. True.
Don't try to be looking good, because that's exactly what you're going to do. Whether you're alone or whether you're in front of the world, in front of the crowd, you're going to do the same thing because your mind behaves like that. Even when you're writing on your own, this is what I used to do for longest time. I used to feel that as if someone is watching me
Mm.
and trying to be good even when I'm alone. You
Wow.
understand?
True, true.
So yeah, so you have to just write it down. Like I tell people, if it's like abuse, write it down. Even if it's your own person, your own father, mother, write it out because you are releasing all that. But they say, how can I do that? No. So first is write down the way it comes without censoring. Second is when you write the negatives, this is my suggestion, never read it.
Yeah,
I
true.
tell almost all my clients, tear it off.
Mm,
Very simple reason. Don't let anyone read it because it might hurt them. Not because, okay. And secondly, you are doing it for a particular reason.
yeah,
You want to release all that what is there. But the other person, when they read it, they feel, oh God, you're thinking like that about me.
yeah.
And if the person is is someone close to you, like your spouse or whatever, it can really shatter the relationship.
Yes.
We don't want, and we don't, and my basic thing is don't hurt the other person.
Yeah,
Do
yeah,
not, you don't have a right to hurt the other person.
yeah. But at the same time, you should not keep it within you. So you should process it
Exactly.
in some way. Yeah, yeah,
So
yeah.
one thing happens when you write it down, it actually allows you to process, because what you're struggling with and what you're suffering because of is the unprocessed emotions and experiences. The
Yeah.
memories which are, they're like a tangle, they are a knot. What you're doing is that when you're doing all this, when you're observing yourself, when you're introspecting, when you're journaling, you're untangling the tangled emotions. You're just separating, you're sorting it out. It's almost like you have a drawer and you removed everything, then whatever is required, you keep, and what you don't require, you throw it off. But only when you can see it, then only you can dispose it off.
Absolutely.
So
I
that is
think,
exactly
yeah.
what is done. So journaling is one of them. Uh, that is how it works. And then I also tell them to write positive things.
Yes. I
Once
think
they have done that,
I heard you say once, I thought I'll quickly give a reference, which you told me also, and I heard you say in one of your interviews also, is that there are two kinds of journal. One is the dump journal, and one is the journal which will help you progress or take the actions needed.
yes,
Right? Yeah.
that is what I generally say. The second one is the moment you complete this, write the positive ones because
Mhm.
now you're installing, you removed all those things.
Yeah.
Now instead of that, you're installing something else. Are you getting me? You remove that old painting, the wall is empty, and now you put a new painting.
Correct.
Or you remove the old furniture, you bring a new furniture. So it's
Correct.
almost like that, which is going to be better and which is going to be more useful. So that is what we are going to do. So write down in the positive present tense and
Yes.
how you want it to be,
How you
how you
want
want
to,
to be in the
like it's
future. So
actually
that is,
happening. Yeah.
yeah, that is a very beautiful way of journaling. That is what I found it to be very, very effective.
Fantastic. It does. And I agree to the first point, just a fun experience to share. I didn't take Sir's complete advice. So this was 2 months back when my mom was downsizing our family home. She found my standard year 8 journal. And she called me really distraught and saying, "Oh my God, you hated me so much."
Yeah.
And I said, "Mummy, I was 15." All
Yes,
kids
that is
hate
what
their parents when they are 15. But then, yes, I forgot to dump it. But
happened.
it really helps. I think it's a catharsis, you get everything out there. Otherwise, it's a very good expression that you shared basically, that when you're writing sometimes, and I think a lot of people who are listening to this will connect to it, you feel like somebody is watching over you, and then you try to be nice even in the journal. Like I have some
Yeah.
clients who come back, especially children, like teenagers, they will come with the journal after, and they will, because they think I'm going to read it, they'll try to be nice, and I'll be like, no, no, I'm not going to read that journal. That's why I also tell them, I said, keep two journals, one which you get here so that we work on the actions, but the second is your journal. You lock it, throw it, do whatever. It's your dump journal. So I because I can see, like I used to see, like they try to be really nice and diplomatic.
I,
Um,
I can tell you one funny incident with my client who's coming just sometime back when I told him to journal, and there's like a lot of negativity between him and his wife. Like he just doesn't talk to her, and she also has so much of negative experience with him. So he says, "I'm so scared to journal," and he brings out his diary. And guess what? That diary has a lock. I told him, boss, if someone puts a screwdriver and opens it, it's going to rip open the lock. You don't have. But the thing is that I said, this is the loose sheet technique. I call it the loose sheet technique.
yeah, that's a good
Another is
idea.
a diary technique. So I tell
Correct.
them this diary is for positives, the sheet is for negative. This is how I
So
segregate
you
it.
write and you throw it off.
Yeah, I always tell them this is a loose sheet technique and this is a diary technique. It's a
Mm,
very helpful way.
good way to put it.
Almost all my clients use this. So instead of writing in a diary and never to read it again.
Correct. Correct.
Never to
Absolutely.
read it again. It's like I tell them, boss, when you go for a dump, you don't keep looking at the shit. You just flush it.
Exactly.
That is how it.
Awesome. Awesome. I think this is brilliant, sir. For our first session together, of course, there's so much I know you can share and tell, and I can keep asking. But I think this is the perfect completion of a few things. I think that we can get to the viewers, and of course, we'll keep meeting with more, because I think there's one topic that I think I really need to do with you that will take an hour, is just the communication part of it and how we
Yes.
communicate to us. I think the NLP side of things, just how we communicate with ourselves. I think the one more bigger topic that's going to help a lot of people is the script, the transactional analysis, the scripts that
Yes.
we use. But I think this will be a good start because I know a lot of people struggle with the mind body connection. A lot of people struggle because in our head, body means chot lagna, falling down,
Yeah.
getting hurt is the only hurting problem, while mind has different problems. But it's understanding that they are together and they are connected. And like you said at the start, your own sickness led you to feel this way.
Yes. Yes.
Just for my viewers
It
to know,
still continues. It still continues.
absolutely. That is my connection with the anxiety that I go through. I was a rifle shooter for 5 years, played
Yes,
for
I
the
know.
nationals. I did not continue shooting because of anxiety. I
Mm.
didn't know what was happening. I would stand there at the range and my whole body would just shiver. Also, one quick example I want to give, like you said, it's not physiological sometimes, but has a physiological reaction. This was 2011, I stopped shooting. I have a shooting range here in Adelaide. I just went there for fun in 2021. So almost like 10, 11 years later. My weapon, which I used to use, was there. And she said, "Oh, you're a trained person. Go pick up whatever you want." I picked up the weapon. I stood in the range, and my whole body gave me the exact same reaction.
Oh, super.
Exact. And I'm laughing because I know logically ki kya ho raha hai. But exact because that was the last time I stopped shooting was at that range at my last nationals of 2011, and this is what is happening to me. And then I let the she was a Paralympic 75-year-old lady who was managing the range, and she was like, "Darling, are you okay? What's going on?" And I said, just give me some time. I was like literally shivering. So I went out, did my tapping, had some water, just sat down, telling myself, "You're not even wearing a gear. Like it's not a match. Just go have fun." And then I went back, but that experience taught me so much about the body and the mind work, and it made so much sense to me of what you were saying and what we were understanding through core somatic. So I think for us all to it is a very important learning to understand the mind and body are, like you said, it's the same. It's
Yes.
same two parts of the coin, and we need to respect our body a little bit more. I feel like we don't respect our body enough.
Yes.
So it's very interesting. So I think journaling and mindfulness and compartmentalization, I think would be the three highlights of our today's talk. Is if we are able to at least start working on these three things. And I think one more important thing, what you said was practice, right?
Yeah.
Practice.
In my book, I have written this. There are three P's. One is practice, perseverance, and patience.
Yeah,
Because patience is something that if you don't have it, you won't last long. In fact, most of the people give up because they don't have patience. Right when they're there, they give up. And that can be success, that can be healing, that can be a very beautiful, uh, like I see married lives,
patience.
marriages
Yeah,
breaking down just because one extra second of patience would have resolved everything. And I have people calling me up, "Oh, I'm going to meet my husband. He said this to me. The in law said, and today I'm going to go and break it." This is just 4 days, 5 days back. I said, "Wait, I'll tell you something." And she listened to me for 5 minutes. Then she went for the meeting. She comes back and she says, "Thanks for that. I saved my marriage. Otherwise, I was just going to say, I'm going to separate." My husband actually spoke to me and he said what he's going through because of me. And I thought it was like the other way around. It's
absolutely.
such an amazing, and I have seen, I'm a very good relationship therapist, very
Yes.
good. I always feel very proud about it. And as
Yes.
people transform their relationship and
Yes.
they come to me last 12, 13, 14 years saying that we want to divorce. And even today, they're they're together, having kids and all that. And sometimes they come back, "Oh, I don't want to stay here." But the thing is that I don't want to get out. I like this marriage. But the thing is that I want to work it out. At 13, 14 years is not a joke when you are coming with an intention, I want to separate and divorce, to making it a happy marriage. They think sometimes it triggers off, otherwise, most of the times it's a good marriage. So they are able to see that.
I think the beauty of your perception towards becoming a great relationship therapist, I totally agree, is because I think you don't, what I have seen, the way you practice, it's not about two of them together, it's about the individual and how it impacts the other individual. And that's what makes a marriage. I think that is something which I've learned from you, and I work it out with my couples or whoever come for marriage issues, because when you get married, I think you take each other for granted, and
Yes.
that needs to stop somewhere. So the work.
Yes. And also what happens is that it's not that you just take each other for granted. You want to believe, and you believe that the other person has to behave like the way I behave because I'm the rightmost person in the relationship, not realizing the other person also believes the same thing.
Exactly.
And both of them are not right. And both
Absolutely.
of them are right. And once you start giving that benefit of doubt or that leeway to them, then you will start this whole thing. And there are steps to it in a relationship. How do you manage the relationship? How do you understand the dynamics? Once
Exactly.
you understand the dynamics, the behaviors, you can change.
Awesome. I think so. Our next topic has to be relationships, because
Oh,
there's
I would
so
love to.
much to talk
Why
about.
do you think I'm telling you? Oh, this is my next. I'm telling you next time.
We
It's
start the next one super soon. No, thank you so much,
You're
sir.
welcome.
But just before we finish it off, like any just quick summary of especially the mind body work or anything, any few of your last thoughts or your last any amazing simplicity that you have and anything
Yeah.
last thoughts to end the session.
So the thought that is going on again and again for last 5-10 minutes is that quote by Viktor Frankl.
Mm-hmm.
Yeah, the one who wrote Logotherapy. You know that.
Yes, yes,
Yeah, the big guy. I
yes,
admire him so much. The man's search for meaning. Yeah.
yes, man, search for
He
meaning.
says between the stimulus and the response, there lies a gap.
Hmm.
And in that gap, human freedom exists.
Wow,
It cannot be beyond this. It just cannot be beyond this.
wow.
So
Between
what you say, yeah, and what you perceive, what you say, if you can allow that gap to happen, you'll save your relationships, you'll save yourself from the stress, and you can put it in anything now. And
yeah.
that is what I practice, that objective, that being objective, being rational, that all comes, that you have to just increase that gap again and again. The more you have that gap, able to keep that gap, the more you will be responding to the situation than reacting to the situation.
Absolutely. Absolutely. Thank you so much, sir.
You're welcome.
As now, whoever has met me, known me, have heard about Dr. Naidu, because I cannot finish a conversation without giving his reference. Now you all know why I'm in awe. He is my dear Zindagi ka Shah Rukh Khan.
Oh, thank you.
I'm not calling myself Alia Bhatt, but I don't mind. But he's definitely that. And I think I think I was this was first year, I think, Mithibai, first year, because of your niece, I think we had met you. It was first year. I think I was only 19. I can
Yes.
happily say that I'm 35. So you can do the calculations. I've known Sir for that long, and I've only learned every time. I meet him sometimes maybe once, 3 months for one session, but that's it. That's enough for me to survive for the next 3 months. Then I need him again. But it's just the simplicity, the understanding, the breaking down, like he said. I think it just connects, and that's my first I always started, like, I was talking to my sister-in-law, just called when I was setting it up, and I said I always wanted, anything happens has to first start with Dr. Naidu. It's like that Nariyal Fodne ka thing, it has to start with him.
Thank
So
you.
I'm really glad that this happened. And thank you, sir. But like we said, we'll keep connecting. I
Yes,
think
sure.
the T connection, like you said, the T came from the thought, emotions, and actions. And
Awesome.
that's the crux of what we are doing. And the idea is to keep working and bringing all these expertise out to the people, because I feel like there is a lot about mental health that's going out there, but still sometimes it doesn't touch the right chord or the right nerve, or people still don't know what to do, how to do, and there's too much information. So the idea is to just get the right information out there so that people
Yes.
know what exactly they have to look for. Is your book on Amazon or anywhere, sir? Where is
It's on Amazon. Giving
it's
up
on
something to receive everything. I can show you the book.
Yes, please. Giving up something to receive anything, is it?
Yeah.
Wow, that is
It
self.
is the hard copy, but there are soft copies are available there
Oh,
for
is
the
it?
soft. Yeah. The Kindle version is available there.
Okay.
This I have still to put it on Amazon. This hard copies.
Okay. But the Kindle versions are there. Audiobooks are there, or is it just those proper books they can read? Okay. I'm guilty. I've still not read it, so I have to read it first. Thank you so much for your time, sir, and
Thank
we will
you.
see you super soon.
Yes, sure.
Bye bye. रुको मैं भी
Idea.
Bye.